that's the beauty of surgery, is that it does get the cancer out, allows you to fully assess the pathology, know whether or not immediate treatment or additional therapy is necessary. Makes PSA more reliable in terms of an indicator of who's got recurrence of cancer.
So when you're considering treatment options for prostate cancer, and when it's narrowed down to either surgery or radiation therapy, one of the advantages of surgery, particularly with the robotic approach, would be for a definitive diagnosis. That is, one is able to remove the prostate in its entirety and confirm the diagnosis that was initially made with the prostate biopsy. Certainly both treatment options are viable depending on the patient type, but surgery, I believe, represents the gold standard for treatment of prostate cancer.
Most guys that have robotic surgery in today's world are actually fully recovered in all aspects well before men that have beam radiation have finished their 2 months of treatment and then another month to recover from kind of the side effects of that treatment. But most men are fully recovered physically when they have robotic surgery within about 2 weeks. At least half the men are essentially dry in terms of bladder function within a month. And most men, if they choose to, can go back to work within a week or two. And long term, those men have the benefit of more reliability in terms of cancer control and knowing if their cancer's been cured. Robotic surgery allows men to recover physically from the procedure in terms of bladder control, sexual function, much better and long term than with either kind of radiation.
Try to think about surgery, because if you have any side effects from surgery, they tend to get better with time. Side effects for the other treatments like brachytherapy or radiotherapy get worse with time.
Complication rates are remarkably low for a remarkable operation. It is an invasive operation, but we've been able to improve our technique, improve how long it takes to recover, to return to work. We've been able to improve how long it takes to be free of pads so that you're continent. And we're working on techniques to improve the time to return for sexual function.
The one risk of surgical removal is urinary control problems, but with our current technology, robotic technology, we've really closed the gap on narrowing down the number of patients that would suffer from that complication. But there are other urinary side effects that go along with radiation that can be much worse than incontinence. Difficulty urinating, pain with urination, inability to urinate.
If the urologist and the radiation oncologist working together put 80 to 100 seeds in the prostate, that obviously causes a significant amount of trauma to the prostate by sticking all those needles in the prostate to insert those seeds, and the radiation in and of itself causes irritation. In other words, from the swelling of the seeds in the procedure, if a gentleman gets up let's say 1 or 2 times a night before the procedure, he'll get up 3 or 4 times a night afterwards.
With robotic technology, we can almost avoid touching those nerves. With radiation, although that technology has also improved, it's still not precise enough to kill the entire prostate, hence the prostate cancer cells within the prostate, and also leave those nerves completely unharmed. And if they get a high enough dose of radiation to the nerves, which are right next to the prostate where the cancer is, then those nerves will get damaged and that patient will lose their erectile function.
Patients will tell that to me. They'll say, I know you want to talk about the erectile dysfunction, because I don't care about that. I just want to cure the cancer. But I do tell them that I understand that now, and the primary goal of your surgery is to cure your cancer. But number 2 is to allow you to recover as quickly as possible physically, and in terms of bladder control, and shortly after you achieve those 2 things, you'll be wanting your sexual function back. And this allows you to do all of those things. The PSA will never come to 0 typically after radiation. It'll go down to low values and needs to stay there. But PSAs can bounce back up again just from inflammation in the prostate caused by the radiation. So within the first 2 to 3 years of treatment with radiation, men still have that uncertainty as to whether or not their cancer has been cured.
It might not go down to 0, and this isn't a successful case. But how do we know an unsuccessful case after radiation therapy is lurking in the shadows during those 2 or 3 years.
I will advise men, it's actually simpler. It's just, you have surgery, you're done with it, the prostate's out, you're recovered, you move on.